Yes, thank you for inviting me for today's talk. I'll be speaking on integrated diagnostics and how it helps in decision making and workflow using the forum Glaucoma Workplace. So, I have no financial interest in the products or softwares that I'm be talking about in this presentation. We know that the parameters to monitor glaucoma include disc evaluation, IOP monitoring, perimetry, and OCT. A good disc photograph is a good way to document the disc appearance, especially when you have more than one physician caring for the patient. And having access to photographs quickly helps in assessing changes that happen over time. Similarly, with IOP charting, if we are able to map the IOP over a period of time, it is useful to get a quick look at the overall trend for the patient, and we can pick up that the IOP, if it's been increasing gradually over a period of time recently or so. Similarly, when we are looking at OCT, now we need to realize that we can't look at only the RNFL, we have to equally consider the ganglion cell layer analysis. And when we combine both these together, we get more useful information. So sometimes RNFL defects, which may be confusing, but when they correlate with the GCA thinning, it significantly increases the sensitivity and the specificity for diagnosing glaucoma. Combining structure and function in our evaluation improves the sensitivity and efficacy while monitoring glaucoma changes. So we'll be going in more detail about this at a later part. But if we are looking at progression of our patients, and if we are looking at individually perimetry or OCT, then we see that only 4 to 5% of the eyes will show correlation and progression in both the devices at the same time. So why does this happen? Well, the reason is that in early glaucoma, we have a redundancy of the retinal ganglion cell layer. So as a result, the visual field does not get affected initially, but the OCT, a well-done OCT, will pick up defects earlier in these early glaucoma patients. Similarly, in advanced glaucoma, the OCT will have a floor effect due to the severe RNFL and the GCA loss. But if we do a properly done perimetry, we'll be able to pick up progression. And in these late stages of glaucoma, we may come across fast progression, which can be seen on perimetry, and especially the central fields like the 10-2.
It is not 4 publication, it is 64 publication.
If we look at the structure function correlation,
if it is 4, then I would not mention 4 is peanut. It's 64.
There's a redundancy of retinal ganglion cells in the initial stages of glaucoma, because of which the perimetry does not show any defect, but the RNFL can pick up early defects. As the damage increases in moderate glaucoma, the visual field as well as the RNFL as well as the OCT both can pick up the defect. While in late stages, the visual field is the one which deteriorates, which goes downhill, and the RNFL will not show any changes because of the floor effect. So the algorithm that we follow in our clinic has been suggested by Dr. Greenfield. And in early glaucoma, we rely more on the photograph and the documentation of the disc images, the imaging from the OCT, and less so on the visual field. But that is also changing with the 24-2C CETA faster. In moderate glaucoma, we depend more on imaging and the visual field. And in severe glaucoma, we rely more on the central visual fields, that the 10-2 test specifically. So coming to today, the main part of today's talk, which is the Glaucoma Workplace, what it does is that it integrates the data from the perimeter, the fundus camera, and the Cirrus OCT and the OCT together in a single software, and we can see the results on the single computer screen. So if we look at what Glaucoma Workplace does, is it does broadly 3 categories of functions. One is archiving, where it archives the reports from the perimeter, the OCT, and the fundus camera, and probably in the near future, also the OCT angiography. And because it saves all the raw data from all these devices, it is capable of creating reports remotely for the perimeter as well as the OCT and the structure function analysis. The most important part, I feel, or the most useful part of the Glaucoma Workplace is real-time custom analysis of the raw data. And with this, we can generate the glaucoma progression analysis from the perimeter data, from the OCT data, as well as the structure function analysis, where we combine the perimeter and the OCT data. So we'll go over a short video in which I'll show you typically how I go through Glaucoma Workplace screen when I'm evaluating my patients. So this is the starting screen where you have the patient's name here and all the tests that have been done for that patient once, and it's very intuitive. So you just double click on it and it opens up the screen. So this is today's visit, for example, the current visit, which is seen here, March 9, 22. And you see all the reports that are present from today's visit. Here you can look at individual reports from the individual devices. For example, this is the RNFL printout. You can also get the progression analysis printout, the GCA progression analysis, also the ONH angiography, then for the other eye. So serially, you can keep looking at these reports. You can also pick up the fundus images and look at them more carefully to see if there any changes have happened. For example, this patient has come 2 years later after the lockdown, and we've seen that there's a new RNFL defect which has happened in the right eye, and so forth. Similarly, what we can also look at the reports like the structure function analysis combined report, where we look at the perimetry, the disc photographs, the ganglion cell layer analysis, and the RNFL all on the single page, and the subsequent pages have detailed analysis of that report. Similarly, we can look at individual perimetry reports. We can draw up multiple reports at the same time on a single screen, and then look at each one of them in more detail. So here I've selected 4 or 5 reports at one time, and then I go to the document display button, and then I have all these reports right in front of me on the screen. So I don't have to go through the patient's file over and over again, look at the various reports individually. So here I can flip through individual reports as they come up on the screen in front of me. And as Dr. Ronnie said, with the Glaucoma Workplace, you can integrate the 24-2C and the previous 24-2 seamlessly. So there's no loss of data, and we can easily look at all the data within no time. Similarly, what we can do is we can select a particular device. For example, here I'm picking up the disc photographs over the last few visits of the patient, going back to 2018, 2016, 2015, and pull all of them up on the screen and look at each one of them individually. And if you look at the first picture and the last picture, we see that there is a new RNFL defect which has happened. So this makes it so much faster, and there is no loss of data. There's no question of loss of patient's file or papers, or your previous drawings which you've drawn on the paper have got lost or got smudged. So all those factors get ruled out completely. Then another good feature is we have all the tests of the patients on the screen, and we can pick up any particular test and look at it in real time. For example, we have the 24-2C or the 10-2, and we can just select it and see it individually if we wish. Similarly, there's another button for looking at the overview. Now, if we look at the same patient starting from 2012, where his right field was almost normal, subsequent fields were also normal for the right eye. And then on the overview printout, we start seeing that the inferior field has started showing a few depressed points, and then he gets lost due to lockdown for 2 years, comes back with an enlarged inferior arc with scotoma, and which has progressed further in the last 1.5 to 2 years. Similarly, we can look at the 10-2 also, and so the convenience of the glaucoma workplace is that you don't have to sift through multiple papers from the patient's file, and you get everything on the screen. Coming to the most important or the most useful part, rather, I'll say, of glaucoma workplace is the structure function analysis. And here we can pull up data automatically from the perimeter as well as the OCT, and uh, all that data is shown in front of you on the screen. So here we have the mean deviation on the upper left corner, and we can also look at what part of the field we want to see. Let's say if the field was mostly damaged inferiorly, we can look at the inferior mean deviation, or we can look at the superior mean deviation, or the overall mean deviation, and see whether the rate of progression is changing. And in this case, the rate of progression was increasing for the inferior field. Similarly, for the visual field index, we can, or and it's so customizable that you can change the buttons anywhere. You can pick any data in any part of the screen so that it becomes more streamlined. On the right hand side, you have the OCT data. You have the average RNFL thickness, average GCL IPL thickness. And for the GCL IPL thickness or the RNFL thickness, again, you can look at different parts. You can look at the upper half or the lower half of the RNFL. And that can give you a better clue as to what part of the field is deteriorating and what we clinically feel that there is progression or deterioration. Is it panning out in the OCT imaging and the perimetry testing? So similarly for the ganglion cell layer also, you can decide whether you want the upper half, lower half. Then you can scroll down to the perimetry, and you have the progression analysis, and the event-based analysis shows that there is possible progression. And at the same time, you can look at the actual pattern deviation plots or even the grayscale. Here I find that sometimes the grayscale, if I show to the patients, it's easier for them to understand that over a period of time, the grayscale is showing some changes. And you also have an option of looking at tabular data. So individual fields, you have all the data which is important from the perimetry gets picked up on the screen, and you can look at individual data from the perimetry. Similarly, for the OCT data, you have the deviation map, which can show a progressive changes or increase in the RNFL thinning. Then you have the color-coded maps also, which shows the thickness map for the RNFL, the GCA. And we can also look at the tabular data or the actual numerical data of various quadrants to see where the progression is there. And at the bottom, you have the disc photographs, and you can click on them and evaluate them further. So in this way, you have a lot of flexibility according to how you want to analyze the data, and multiple forms of analysis are available to us very easily, and it hardly takes any time. So here, for example, this is a 8-minute clip that I've done with screen recording, and in these 8 minutes, I've looked at 10 years of the patient's data. Another useful thing which I've seen is the progression summary which comes, and that shows that the machine automatically analyzes the various parameters for progression, and you can click on either of the eyes and it expands into the structure function analysis for the patient like we've done just now. So here you can also evaluate the cup disc ratio and other parameters. So there is a lot of customization available, and I feel that it's a fantastic tool to use. So In my clinic, what are the advantages that I've come across with after using Glaucoma Workplace for the last 8-10 years that I've used it since 2013. One is that what I've acutely become aware of it is in the last 2 years, I don't have to sit in front of the patient and analyze all his reports. I can sit in my chamber, look at it on a remote terminal, look at all the reports at a remote terminal, go through it in all details. So I'm completely armed with all the data for the patient. And when I go in the examination room to sit in front of the patient, I can quickly explain everything to them. So detailed analysis of the reports is available remotely. So we are better prepared when we see the patient in the exam room. As a result, what happens is that we save a lot of chair time, and it also improves the quality of chair time. So this results in better communication with the patient. And as a result, the patient's self-confidence improves, patient's understanding of his condition improves. This results directly into better adherence and compliance to therapy. And the added advantage is that the graphic presentation on the screen is very intuitive and has an easy layout with very simple graphs. So this is very easy for the patient to understand. So to summarize, the advantages of Glaucoma Workplace are in archiving. We have all test data available, which can be accessed anytime, anywhere, through cloud or through remote access through a LAN cable also. And of course, there is no risk of data loss. Reports can be generated anytime without accessing the individual machines, as the software from all the machines gets stored on the forum software and we can analyze it there. The real-time analysis of data gives us the capability to do custom analysis and reports, example, the upper or the lower hemifield data from the perimeter or the OCT. And real-time study of the glaucoma progression analysis, not only for the perimeter and the OCT, but also their correlation to study the structure, function, progression. And I wasn't able to pull up the report of the structure function GPA in the video, but you can get a special report which talks about the structure function progression, and we can give that to the patient. So the Zeiss Glaucoma Workplace is an invaluable asset to glaucoma practice, as it adds value to the better management of glaucoma for the patient as well as the physician. And I can vouch for it because we've been using it since 2013, and it has become an integral part of our management process. Thank you.